Okay, so let's start with our introductions. So this is our Omnos webinar series, and we are going to be focusing on gut health, our microbiome, and how the low FODMAP diet can potentially help gut health, or gut health issues, I should say. So here today I have Sasha. So thank you, Sasha, for joining us. We are going to have a nice little conversation and talk about your experience and hopefully give some tips to people around some things that they can explore, and also just try and cut through some of the noise that we hear, because obviously gut health in a good way is a lot, there's a lot of it in the media at the moment, which is good because it means we've got more awareness around it, but at the same time we're obviously getting some misinformation around there, so we're just going to try and pull on some of that and make it make sense, I suppose. So yeah, a little bit about Omnos. We are a health optimization company. We do various different tests, looking at hormones, nutritional status, microbiome, environmental toxins, those sorts of things. But our main ethos is around trying to help educate people and actually make more informed choices around their health through testing. So like I say, welcome, Sasha. Thank you for joining. I'm Hannah. I'm a registered nutritionist. I work at Omnos. My background is originally I qualified with sport and exercise science from Loughborough. I did sports nutrition as part of my dissertation, looking at appetite. Really loved the nutrition side of things. I then went on to do a master's degree in human nutrition. There I actually had IBS, so naturally started studying gut health, looking into IBS, and that's kind of what brought me to kind of looking into things like the low FODMAP diet. But yeah, Sasha, obviously you're co-founder of Field Doctor, but if you could give us a little bit more information about yourself, that would be fantastic.
Yeah, definitely. And thanks very much for asking me to join you on this fantastic topic of gut health and IBS. So my background is I'm a registered dietitian. I have a specialist interest also in gut health, particularly irritable bowel syndrome. And I did my MSc in allergy. And I've been involved in various research studies around irritable bowel syndrome and IgE mediated food allergies, but I've also worked across public health and weight management and a range of different areas within the nutrition sector before going off to get involved and help design some meals as part of Field Doctor, where we make healthy frozen ready meals for people for specific health goals and health needs, to give them convenient solutions that are really science-led and based on the right information. As we know, it can be quite fatty and a lot of mixed information about what you should and shouldn't be eating. So we wanted to make sure that we could base it on good science-led peer-reviewed evidence.
And that's, that's kind of partly why I was so excited to meet you and actually invite you onto this webinar was, as I mentioned, having gone through gut health issues myself, and studying IBS, studying the low FODMAP diet, I noticed that we will talk obviously more extensively around what the low FODMAP diet is and what can cause and trigger IBS, but I found it really helpful, but I found it really difficult following the low FODMAP diet simply because there wasn't any convenient food that was low FODMAP. So actually, there's definitely a market for this. It's super helpful, and it's really good actually having someone behind it that understands the science of it. So kind of, I guess the first thing really is kind of wanting to explore what is a healthy gut, Sasha.
Yeah, that's a big question. I think, it's a really, really exciting area where the research is just exploding at the moment. And I think what we've learned in the last 10 years has just put us forward in our knowledge so much. But what I would premise the answer to this question is there's still so much that we don't know. And I think there's this realization that we're just at the tip of the iceberg of understanding the role that our gut has in our wider health, but also what's going on in the gut. I think, it's a hard one to answer what a healthy gut is. Because we're all completely different. And what we're starting to find out is, we'll talk a little bit more about definitions about gut microbiome and microbiota, but, our gut microbiomes are as individual as fingerprints. And there's so many different components that makes up your gut microbiome. And whether it's good or bad bacteria and their relationships and, other things and signaling. So it can be very complicated to understand what defines a healthy gut. So I think the best definition is probably to think of a healthy gut as one that's with an absence of disease, where you're not sort of, no gut symptoms specifically, or sort of inflammatory diseases such as celiac disease or inflammatory bowel disease, which we will talk about later.
I mean, it is a bit of a minefield, but I think, you've drawn on some points there. And actually, one thing I kind of forget sometimes is that actually when we talk about the gut, most people think of literally your lower bowels essentially, but actually it is obviously everything. It's from where when you're eating all the way through to exit. So it's the entire system and how that's all working, because some people might have a small something slightly going wrong in their in their stomach, but their lower gut is actually fine, and vice versa. So I guess that kind of brings me on to what is the gut microbiome and microbiota, and I put both words here because it is used interchangeably, and I don't think really it overly matters like when you're talking about it conversationally, but if you can kind of give me a little bit of a insight to the difference between your microbiome and your microbiota, that would be really helpful.
The word gut microbiome actually refers to the genomic material that makes up your gut microbiota. The microbiota being this mix of organisms that are in your system or in your intestinal tract, all the way from entrance to exit, as you mentioned. And as this slide wonderfully explains, it can be live bacteria, viruses, fungi, and we know that the number of these cells in our body, or these organisms in our body, outnumber our living human cells, which is just extraordinary. There's lots of different estimates of how much, and you've put on this slide 39 trillion microorganisms in our cell. And if I'm right in remembering the ratio, it's something like 50-1. So in many ways, we're more our gut microbiome than we are human. And, it really, really makes up and plays around. And we've evolved together with this microbiota. And obviously today we're talking about gut health and we're talking about your gut microbiota, but there are lots of different microbial ecosystems across your body, on your skin. We mustn't forget sort of our mouth, in your eye, in your armpits, and all of them are completely different. In fact, even on your fingertips, and you might have different populations living on your left hand to your right hand. So it's a fascinating area. And I think what's incredible is I think there was a view that, we are born with this sort of empty, clean, sterile gut, and it's sort of upon birth that whole seeding process starts. And then it just gets more and more populated, and the variation happens depending on your exposure to different environmental factors, or even genetic factors. We know that people within the same family groups have much more similar gut microbiomes than those in different groups. But your gut microbiome also changes across your age. As you get older, it becomes less diverse. So yeah, at one point in time, there's so many things that are happening, and that one point in time may be very different to what's happening in a week's time if you've changed your diet, or in 10 years time, for example, if you're a woman and you become menopausal and there's all these hormonal changes. There are a lot of factors coming into play that define what your gut microbiota looks like.
Yeah, no, thank you. That was a really excellent explanation. And I think one thing that I find personally fascinating is that we kind of now look at it as its own organ, and it actually can talk to our body outside essentially of outside of our brain. So your gut in itself has its own mind, as it were, and it obviously helps to create a lot of like neurotransmitters and hormones, and helps with metabolism. So it's honestly, like, in my opinion, fascinating, and it really goes to show why gut health is so important. And obviously we'll kind of come on to what impacts your gut microbiome. But yeah, as it kind of says on the slide here, it's also super important for things like our immune function. And actually,
yes, 70% of immune cells are actually based in the gut. So there's this incredible interface between even how, these microorganisms are this interplay between the microorganism and our immune system and these immune cells. And we know, and there's emerging evidence to show that, your gut health can play a role on mental health. I know you sort of touched on the gut-brain axis, and we see that just by changing what you eat can affect, and improve levels of depression, for example. But we also know that it can have an effect on blood glucose regulation, and possibly even, reduce your risks of other things such as cardiovascular disease and cancer. But there's a lot more research happening in this area for us to really understand what those mechanisms are.
Yeah, and actually, I even recently saw around how, on this slide here, we've talked about how the microbiome, interplays with your metabolism, your immunity, as you just talked about, inflammation, but also we're now looking at things like the skin gut axis. So, so your skin gut axis and your eyesight, not eyesight, but the eye gut axis as well is now a thing. So it's not just these three things here, it's just kind of a list that's continuously getting bigger and bigger. And actually that kind of brings me on to the next point of what impacts your microbiome. We've obviously got here your food and your diet, which we'll talk about in a bit more detail, your environment, as you mentioned, medication. So things like if you have antibiotics, that can obviously make a difference to your microbiome, how much, the water that you're drinking. And actually something that I think is quite interesting is, if you're breastfed, if you're birthed via the, birthing canal, or by cesarean, these are I just think it's crazy. And like, if as a child you have a really diverse diet versus not having a diverse diet, or if you are, there's also all this talk about how clean you are, in terms of if you're playing, it sounds a bit weird, but almost the more hygienic, obviously that's going to make a difference to your microbiome as well.
Yeah, absolutely. Every time you say that, I cringe a little bit, because I had my son, unfortunately, via C-section, and 10 plus years ago, and now all the things that we've even learned in that time period. But yeah, I was involved in a research study where we were in South Africa, the first research study around food allergy prevalence in toddlers, and we looked at two population groups, one that were urban and one that were rural based, and the prevalence of allergies was completely different. There were a lot more food allergies in those in an urban environment, and when we looked at a lot of the factors, it came down to what we think is these gut microbiome factors and sort of the exposures that they were having in a rural context that were probably providing some protection, you know, playing in soil, much more exposure to farm animals, much more exposure to outside, less exposure to air pollutants, more likely to have been breastfed. And so all these factors stack up to play in your favor for a more diverse and more beneficial gut microbiome.
Yeah, it's fascinating. So yeah, I suppose the next thing then is what can we do you know, in adult life to improve our gut health? Obviously, you know, again, I'm using gut health and microbiome slightly interchangeably here. But you know, I've got some points here, but we'll just kind of discuss that in a little bit more detail. So I think the first thing really, and this is something as a nutritionist I try to, doesn't matter what we're looking at, where, you know, this is something that I'll always try and to touch on is increasing the variety of food in your diet. And that doesn't, it's obviously fruits and vegetables, but different grains, different nuts and seeds, different types of meat as well, if you eat meat. And it's just getting that variety, which gives you the different nutrients, but it'll also give you the different types of fiber, which is obviously the next point. So I don't know if you wanted to touch on the 30 grams of fiber a day.
Yeah, definitely. I mean, I'm passionate about fiber because I think it's been largely neglected, and it's such an important component of our diets. The goal is to hit 30 grams of fiber a day. The majority of the UK population are not even hitting 18 grams. And it's not just about the quantity of fiber, but it is, as you've touched on, the quality of fiber and the diversity. You know, different bacteria like different types of fiber. The fiber is a food that will feed, and we will, next line is about prebiotics, but you know, it's this food for your good gut bacteria. And there was a research study done that showed that, you know, those who ate more than 30 different plant types in a week had a much more diverse gut microbiome than those that ate less than 10. And we all know how easy it is to sort of get stuck into the same routine of the same repertoire of recipes that we're cooking. You know, on average, I think people have sort of 10 recipes that they are circulating and repeating all the time. And it's really important to shake things up a little bit and, you know, to try different grains. We, you know, 60% of the calories that we eat come from 3 crops: maize, rice, and wheat. And, you know, there's all these amazing other grains that exist, such as barley and spelt and buckwheat and quinoa. So just to try these things. And obviously there's legumes and fruits and vegetables. We talk about trying to eat a rainbow, and because obviously with all these different colors come lots of different polyphenols, which, yes, they act as antioxidants, but we also know that your gut microbiome and different bacteria love those polyphenols, those pigments that come in those different gut that come in those different fruits and vegetables.
Actually, it's interesting. I haven't put it on here, and we'll touch on coffee or caffeine in a bit. And what's I think what's tricky about gut health, and we'll talk about this obviously in a bit more detail, but what's tricky is that sometimes what can be good for your gut can also be what causes, you know, irritation. Yeah. So for example, coffee, which we know can be an irritant for the gut, is also, you know, they're high in polyphenols. So actually it can actually be good for the gut. And actually I saw a post around that recently, around how
I think it was Tim Spector yesterday talking about it. Yeah, I know. And I think the issue is also to remember that, you know, as you've rightly put on the slide, these are key components that should work across the board for everyone, and something that we can all try to do. But then there are these individual factors that come into play, and no two guts are the same.
And I think, so for people watching, essentially what we're trying to get at here is that on this slide, these are the most common things that will improve your gut health, and for most people. So this is making it, you know, this isn't necessarily targeted at if you've got a specific problem, i.e. bloating, because that's going to have a different approach. But this is just a generally healthy diet, healthy gut, sorry. We'll kind of come on to a little bit more about how, you know, personalizing it can hopefully make a difference if you are potentially, you know, experiencing gut sensitivities of some sort. But this, you know, exercise, for example, that can improve your motility. So if you've got potential constipation, we know that exercise can help. But again, it can also be something that if you over exercise, it can cause inflammation in the gut. So again, it's, you know, I think with anything, it's like if you eat too much broccoli, it's not going to be great,
You're gonna
right?
have too much of a good thing, too
Exactly.
little of a good thing, and too much of a good thing.
Exactly. But yeah, so we've got here pre and probiotics. A lot of people kind of get confused about that, but essentially we're looking at things that feed the gut. So your prebiotics, the types of fiber essentially, which you're going to be getting from your different types of grains, legumes, fruits and vegetables. You then have your probiotics.
Inulin, chicory root. I mean, asparagus is a great one because it's high in inulin. Yeah, it's food for your good bacteria.
And then you have your probiotics. So this is actually introducing a live bacteria into your gut. There is mixed research around probiotics and what is the best strain and those sorts of things. But, you know, you can also get it in fermented foods, which is a really kind of great way for a lot of people to get it in a kind of natural source. And then
I would just add on that the research around probiotics has not been conclusive in terms of recommending that you should take one every day, because of course we don't necessarily know what you're missing. So it's hard to know, you know, when you're choosing a probiotic, there's lots of different, you know, either they're single variant or they're multivariant, but it may not be the actual bacteria that you need topping up on. There has been some really good research studies around certain strains to help against something like traveler's diarrhea, and you know, sort of a debate to show some that are beneficial in certain conditions. But as a whole, yeah, the jury is still out on them. I personally still, you know, I'm a big advocate of fermented foods. You know, we've been eating them in a millennia, and I you know, whilst the research hasn't yet conclusively shown anything around supporting sort of kefir and kimchi and sauerkraut, I think that there is some really good value to be had with including those in your diet.
I actually think they taste great. So, I mean, why not just add them to your diet? Kind of adds that fiber and as well. So but yeah, so and then I guess the last thing there is stress management and mindful eating. Again, we'll kind of touch on it in a bit more detail, but did you want to kind of talk me through kind of the gut brain axis in terms of how stress can potentially impact your gut?
Yeah, before we do that, one other thing that I wanted to point out on food actually is this concept of processed versus non-processed foods. And there's some really interesting research that's emerging, in fact, from the PREDICT trial, that was showing that processed food, be it plant-based or non-plant-based, was not great for your gut bacteria. So, you know, the level of processing, and we all eat some level of processing. You have to process some things like pasteurizing milk. And so I'm not saying don't ever eat any, you know, cheese to a certain extent has to be processed for us to, but I think when I talk about processed foods, it's these ultra processed foods where you look at the back of the pack and you cannot recognize most of the words on that ingredients label. And it has changed form from, in many versions, away from the original food that it was based on. It often has high fat, high sugar, and high salt added to it. So I think definitely to be careful on that. I think, yeah, in terms of stress, it's a difficult one because it can work both ways. And we do know that there is this sort of gut-brain axis, and that it talks, and sometimes you can kind of get a bit of a vicious cycle. You know, when people are feeling sort of a high level of anxiety or stress, you see gut symptoms, you know, a higher rate of, for example, diarrhea occurring. But likewise, you can get it the other way, that, you know, by having these gut symptoms, it can make you extremely anxious too. but there is definitely a closing. And, you know, even by eating your meals too quickly or not being mindfully present, you know, you can sort of override. I think there's these amazing sort of satiation cues that are written into our body, and this ability for all the processes to happen, but then you have to sort of be present, engaging in every mouthful and enjoying it, rather than just, yeah, I guess sort of plowing food into your mouth and thinking about it.
Yeah, no, and that's a really good way of putting it. And I think with stress management, I know, yeah, and mindful eating, I suppose, it's taking it away from a stressful situation, actually sitting there enjoying your food, like you say, being present with it can really help. For some people, actually, there are some kind of mindfulness apps around food that can actually just doing that as an intervention can actually really help their IBS kind of things. Obviously, again, we'll talk about IBS in a bit more detail later.
Yeah, absolutely. There's great research that has now shown that mindfulness and hypnotherapy, and even to a certain extent cognitive behavioral therapy, can help alleviate IBS symptoms.
So, and actually, I just wanted to talk. I know we'll talk about polyols properly in a minute, but you mentioned about ultra processed foods, and again, we'll talk about how everything is personalized. So what will work for one person won't necessarily work for another person. But basically, if you consume way too many, you know, I know that sweeteners kind of have a bit of a bad rep, but you know, if some people, you know, myself included, having a lot of the sweeteners that are added to foods can also, you know, cause kind of gut bloating and things like that. So
absolutely, a lot of these sweeteners are polyols, as you sort of touched on, and all of us, lack the enzyme that breaks these down to be able to absorb them. So if you have too many polyols or sugar-free, you know, take an example of sort of like sugar-free sweets, you know, one of the side effects, unfortunately, can be diarrhea because they have a laxative effect. So yeah, I think, you know, it's this thing of, and the problem is, the more ultra processed food that you are bringing into your diet, it displaces the good stuff. So, you know, by just taking that out and bringing some of the other foods back in, you're automatically adding good stuff in by taking some of the bad stuff out.
Actually, just a really quick kind of like sciencey part, I suppose, is when you're feeding the good bacteria with the things that we've discussed, i.e. fiber and actually even things like healthy fats can also be good for your gut bacteria. By feeding them, that actually can help to kill off and make it not the environment for bad bacteria. So, you know, it's kind of a full circle, I suppose. Actually,
and I think you touch on this great point of the fact that I think we also have to stop thinking about, you know, just what we like eating. We've got to think about the other population that we are feeding, and that we have a responsibility to look after them, because if we look after them, they will look after us.
Yeah, no, that's a great point. So actually that kind of brings me on to our microbiome test that Omnos offer. Now, this is a stool test, so it basically, you know, we look at people's poop, which is lovely, and we can look at levels of what we think to be good and bad bacteria. We can look at some markers that look at things like inflammation that could potentially indicate if you have something like inflammatory bowel disease, which we'll talk about in a second. There's zonulin, which could potentially allude to things like if you have leaky gut, or in scientific terms, it's around the permeability of your gut lining, which will obviously impact how you're absorbing food, essentially, and absorbing nutrients. And this is a really good way to get a snapshot of where your gut is right now. And then if you wanted to then implement different kind of interventions, so like changing your diet, or, you know, if you did decide you wanted to take a probiotic, or if you did decide that you know, your exercise, you know, whatever it is that you decide to change, you can then obviously then reassess it and see how your gut microbiome is kind of responding, I suppose. And we've got a little discount code for you there, 20% off, so GUT20. But yeah, so that's just kind of a really brief overview of our microbiome test. I don't know if you have any comments on it at all.
Yeah, I mean, as we said, there's just so much that we're learning in this area. So, I think it's great to get an idea of microbiome abundance and diversity and start to understand a little bit about the landscape of the different populations of bacteria you've got in your gut. We don't know yet quite the answers of what that always means. If you've got this particular type of gut bacteria, that doesn't necessarily give you the answer of, say, for example, you're less likely to develop type 2 diabetes. But I think it's a great to sort of get a picture. And then I think, as you said, then you can get another picture again later on if you make some substantial changes to your diet. Or, for example, there's been an issue and you've had to take lots of courses of antibiotics, for example, and you want to see whether or not you've recovered to that picture of what it was like before your illness. So, and I think it's, we didn't talk about short chain fatty acids and butyrate, and they're huge importance. So it's not just, it's also what the gut bacteria do to the food that we eat, to the food that we don't digest, they work on, and then they produce these compounds called short chain fatty acids, which then go on and play various different roles in our body and sort of signaling.
Really beneficial things, by the way.
Absolutely, all good things. So, yeah, very, very useful to know. And we'll talk about the calprotectin test as well around inflammatory bowel disease.
And just one last thing I suppose I'd like to kind of add around the microbiome test is that we offer a kind of a short consultation post test, and then we can offer various consultations afterwards as well. And the reason this is important is that it does require someone to interpret it and be able to give you actionable changes, and also be able to say, this is an indication of it. It's not, nothing in anything really is ever 100%, but it's just having that someone actually give you the aftercare, do the test, see how it, see what your results are, rather than just kind of going at your own devices and being like, I have no idea what this means. I think that's quite an important part to
Agreed. And I would say that, I'd say that for, all tests, I think, there is this great thing that we all want to take back control of our health and arm ourselves with this knowledge. And I think it's fantastic. We should be able to know these things about our bodies and about our health, but to do it alongside a trained healthcare professional to get that guidance so that we can understand what it actually means, interpret it, and translate that into good, useful actions rather than bad actions. Because the risk is sometimes that we do these tests, we think we do get an answer, not gut microbiome test, but various other tests, and then we start removing things from our diet, and we may actually do worse things to our health than good things. So always do this alongside a trained healthcare professional.
Yeah, no, couldn't put it better myself. So bringing, kind of going on to IBS now, so your microbiome, i.e. the bacteria in your gut, is one part of quite a big puzzle when you look at your gut health and things that can potentially cause IBS. So I guess that kind of, on the basis that 20% of the population, if not more, suffer from IBS, I think it's a really good thing for us to try and break down what IBS is, what the difference is between IBS and IBD, some symptoms, and then also we can kind of move on to what might be triggering it and what things you can do to alleviate it.
Yeah, so IBS and irritable bowel syndrome, 1 out of 10 to 1 out of 20 of us can have IBS. What's amazing is that there are 50% of people are actually undiagnosed and living with irritable bowel syndrome symptoms and not really realizing that they have IBS. Women are more likely to have it as well. So it is what we used to say was a functional gut disorder, meaning that there is no, when you're sort of doing endoscopy or having a look at the gut, one can't see any problems with it. It's not as if there's any ulceration or a change to the gut lining. It's just that there is this functional change. And symptoms do vary from person to person, but the symptoms that are most common are abdominal pain, accompanied by symptoms such as discomfort, wind, bloating, and urgency to go to the toilet, flatulence, diarrhea, or constipation, or both, or even alternating, and rumbling noises and feeling better after going to the toilet. But what most people don't realize is it may not just be gut symptoms. You may also struggle with fatigue or headaches or back pain, insomnia, anxiety. So, you know, it can be quite complex. It's a very difficult condition to diagnose because there isn't a test for it. You can't just go to the GP and they do a blood test and tell you that you have IBS. The diagnosis of IBS is by exclusion. It's really important to go see your GP to get a diagnosis of IBS, because they have to rule out various other conditions where the symptoms overlap. And you've put up here inflammatory bowel disease being one of them, where one can be sent for this test, this calprotectin test, to rule out that it's not inflammatory bowel disease, and celiac disease test being the other one, where you go and do a blood test for that via your GP. And only once these conditions have been ruled out, because we want to make sure that you're not given the diagnosis of IBS and you actually had, you actually have celiac disease, then you've got this confirmed diagnosis of irritable bowel syndrome. And, you know, it is a chronic disease. You know, with ebbs and flows, people can have relapses. It really can affect your life hugely. People sort of laugh it off, or people don't want to talk about it because they may be embarrassed, but it may stop you going to work. It may stop you having relationships. And, you know, it's been shown to, you know, have a really, really big impact on your quality of life.
Yeah, I was actually going to say, I really try to encourage my clients and friends and people to talk about poo and to talk about gut issues, just to like try and normalize it and get people a bit more comfortable talking about it, so that, you know, if you do have issues, that people actually, you know, try and do something about it.
And that people realize there is help and there is so much that they can do about it. And you don't have to live with these symptoms and continuous pain, and, you know, you can go and get help. So I think that's sort of a real positive bit that people need to take away from it.
And actually, you kind of picked up on cow protein. How do you pronounce it? That is something that, if that has been missed or you haven't had diagnosed before, and you were to do a microbiome, that is something that's within there. So at least, you know, if it were to be flagged, that's something that we would then be able to kind of help someone with. But yeah, the celiac, as you mentioned, that would be a blood test of your GP. But yeah, so kind of moving on to what can cause IBS. As you've already mentioned, it's very difficult to know exactly what causes it. You know, there's so many things, and I suppose some research that I've seen actually kind of basically says that when they analyze the food that is being eaten by someone that's suffering IBS and someone that's not, there is no functional or physiological differences in what's going on, but they're reporting more pain. So there might be just hypersensitivity or higher pain receptors within the gut. That could just be, it could be something like that. It could obviously be food sensitivities, so food's not getting absorbed correctly, or it potentially is causing inflammation. We'll talk about allergies and intolerances in a second. And actually, this is why I'm really passionate around this area, is because it took me so long to understand it well, to kind of get to the bottom of things. And you try and like, a lot of people kind of get these IgG blood tests, which gives them extensive lists of foods that they can't eat. And half the time, most of the time it won't work. And if anything, it makes it potentially worse, because you're not getting the foods that you need. You then get stressed about the fact that you can't eat all these foods. The stress then makes it worse. But yeah, so I suppose, I've kind of popped there in the slide some of the things that can trigger IBS. As you've said, we don't 100% know. It is a very personal thing. We can do care with a health care professional. You can do, symptomology and look at what's going on. But yeah, so I suppose the first thing is for you to add to anything here in terms of what may cause or trigger IBS.
Yeah, I mean, as you say, it's hugely personal. I mean, I have seen patients in the past who actually developed IBS after a case of severe gastroenteritis. They had a case of food poisoning and then went on to develop irritable bowel syndrome. Other people, it may be because of stress and lifestyle factors, or it could be due to experiences in their childhood. We know that early life stresses, such as even sexual abuse, increases someone's predisposition for experiencing irritable bowel syndrome symptoms at a later stage. And I think you mentioned this sort of visceral hypersensitivity. There is definitely sort of, this a change in this visceral sensitization where people feel more pain. Their guts may look exactly the same, and there's been tests where they've put up a balloon in the rectum and sort of expanded it, and what they have found is that some people just felt more pain on the back of that balloon, were more likely to have IBS than those that did. They're just much more, I think, those neural pathways and pain receptors are just firing maybe more often. So yeah, I mean, I wouldn't say that food allergies cause irritable bowel syndrome. And I know that you've put food allergies and food intolerances. So maybe should I just kick off and sort of explain the difference between the two of those?
Yeah.
There's often a family history. Sometimes people who have had a family history of food allergies may be more likely to get irritable bowel syndrome, but it isn't necessarily a food allergy that's causing it. It's actually very rare that you will have a food allergy that causes it. Food allergies are referred to as defined as IgE mediated allergies. They are an immune response. They usually occur within 2 hours of eating a specific food. Commonly, you'll know of eggs and peanuts and milk. And, symptoms can affect your skin and your gut and even your airways. And at its most extreme, you'll have heard the term anaphylactic shock. There is even a risk of death if you don't, you eat a peanut and you don't have an EpiPen at that time.
I think where I was kind of coming from with the food allergies is that it can be almost mistaken, like some of the symptoms are similar to IBS. So if you are having gut-related issues quite quickly, people might just think, oh, I've just got IBS, but actually it's a specific food or an allergy that could potentially, be causing something. But
one thing I would add is that most common is sort of like itchiness. You might see urticaria, these sort of like red rashes. Sometimes those symptoms, it usually may accompany some gut symptoms. So it's that gut, however, there are these non-IgE mediated allergies that you are right. They have a much more representation that is gut focused, and they are not picked up in the traditional skin prick tests or specific IgE tests, of which there are tests to help you diagnose a food allergy, but you do it alongside a clinician. And definitely save your pounds. Don't do an IgG test. Those are not reliable and do not give you any information around IgE tests, allergies at all. However, there are all these food intolerances, and there are very limited tests existing to diagnose those, and those may have gut symptoms, as you've touched on, Hannah.
Yeah.
You know, for example, lactose intolerance, that's one that people have heard a lot of. That is because you simply just don't have enough of the lactase enzyme in your system to break the lactose down into its component carbohydrates for the absorption process to happen. And there is a test, you know, there are tests for lactose intolerance. The other one is non-celiac gluten sensitivity or gluten intolerance. There is no test, unfortunately, for that either. And other intolerances include histamine intolerance. And within this area of food intolerances, you can feel very unwell. You know, unfortunately, you can't do a blood test. The best way for managing it is really through a process of elimination. To do it, go see a dietitian or a registered nutritionist who has got experience within allergies and intolerance to help you along the process of this elimination diet, because they can sometimes be complicated, and you have to ensure that they are nutritionally balanced and that you are eating the right foods, even if you're trying to remove some of these trigger foods. And then you need to reintroduce, there was a process of reintroduction to understand what the possible triggers are, because you don't want to live your life having removed something from your diet and not knowing. And a lot of people remove gluten. I think gluten is the one thing that everybody's taking out. And often it's not gluten that's the issue. It may be something called fructan intolerance, which is part of the FODMAP diet, which we'll get onto. But, you know, I think don't remove things from your diet unless, you know, go and get some help, because the minute you start removing more and more things, you know, you get very nervous about reintroducing them. Why would you introduce food if you think it's going to cause issues? And then here comes the gut-brain axis, the fear factor, the stress symptoms that come with that. And the more you remove, the more likely you are to be missing valuable nutrients from your diet. And we spoke about the importance of diversity and variety in your diet and why you need to eat all these foods.
Yeah, fantastic. And just before we go on to the low FODMAP diet, and other things that you can, other areas in the diet that you can look at for IBS, just to kind of clarify with the food allergies and versus food intolerances. So you can get a test for a food allergy. You have to get that with a clinician, just because there will be certain things that they need to ask you to make sure that they're testing for the right thing. And that's an IgE test. Now, this is valid, this is scientifically kind of backed up, and then you have your food intolerance tests, which you can get online, but they're not necessarily, well, they haven't got enough evidence to suggest that they are valid. And actually, if anything, when I found this out, it made me laugh. Basically, what they do is they are giving you an insight to the food that you have eaten. So what will happen is that if you eat chicken quite a lot, you might have an IgG result that says you are intolerant to chicken. But all it's doing is basically saying you've had a response to chicken, and it doesn't mean that you're intolerant to it. So you get this long list of things that you're cutting out, and it honestly will not help.
And it may be a list of 20 or 30 things. I've done it. I got bananas and coffee, you know, on my list of 20 plus things, plus lentils and all those things. And, you know, I'm actually fine when I have them. It's just because I have bananas pretty much all the time. And of course, couldn't live without coffee. So.
But yes, I just wanted to kind of...
well explained. Yeah, that's correct.
So yeah, so then what can we do? This is just, I think the first, you mentioned earlier about the first line of dietary modification, and things that we can potentially do if, you know, if people are suffering IBS. What would your first port of call be before eliminating anything?
Absolutely. I mean, I think people often turn to diet first because it's something in their control that they can change. And there is a lot that you can change with your diet. I think firstly, you can think about what you eat and start to take out some of these processed foods, high fatty foods and sugary foods that may be aggravating your symptoms, fast foods, pizzas, creamy sauces, crisps, for example.
You can have these things, can't you? But if you're having them all the time, it's almost like that cumulative effect. Like,
Absolutely.
I get really bloated if I have really high fat food, not because it's the fat in itself, but it's the fact that you're having so much of it at once. Your body just cannot deal with it, essentially.
Yeah. And often these foods don't contain any fiber because they're highly processed. And so it's no surprise that you might then be experiencing constipation as a result. You still want to be including good fats in your diet, olive oils, nuts and seeds, but to really think about some of these, ultra processed foods. Fluids are a really important one to ensure that you're drinking sufficient fluids in your diet, aiming for sort of 2 liters a day. Looking at some of the triggers, there are some sort of gut irritants, such as coffee. We know if you're drinking too much coffee, that can increase gut motility. And we know that alcohol is also an irritant, so to sort of limit your alcohol intake. Also looking at eating regular meal times. I'd had patients in the past that was just eating one meal a day. So, their gut's effectively not doing anything all day, and then it's dumped with this big meal that it's then having to process, and then they go to bed. No surprise that they're experiencing symptoms of bloating and discomfort. So trying to eat regular meals during the day, trying not to skip meals or eating late at night. Also taking time to eat your meals. Think about not just what you're eating and how you're eating, chewing your food well. We spoke about being mindful. Also make one change at a time. Obviously we want to just get that perfect diet or remove all symptoms. But if you make too many changes, you don't actually know which is the change that's had the impact. So I would recommend for anyone that is experiencing gut symptoms to keep a food and symptom diary and keep it for a week and just look at what you're eating and how you feel. Don't make any changes for a week and just look at that. And that can be a very useful tool when you then go and see your GP or a dietitian and take it with you, because you'll start to see some of the patterns. And then when you do make that change, you can again see the patterns and the symptom changes.
So one thing you also, I think, is an irritant is spicy food as well.
Yeah, it can be.
I think that's why a lot of, there's a lot of people that will, drink the night before or have spicy food, and it's kind of that accumulation of irritants. I know that if I drink alcohol, that in itself doesn't give me a tummy ache, but if I then have coffee, I have coffee every day, love coffee, one of my favorite things in life. But if I have coffee the morning after having drank, I get a really painful stomach. And I think that's partly to do with the fact that we've got the irritation from the alcohol plus the irritation from coffee. So it's sometimes a cumulative effect, but it's, sometimes just cutting back on a couple of these things might make quite a big difference.
And you mentioned exercise and relaxation is really important. We haven't spoken about sleep, and actually getting a lot of sleep or enough sleep is a really important component too.
I think there's research even looking at things like yoga as a way of reducing your stress levels, can improve many things, not just your gut health, but and then so I guess it's that holistic look. So are you sleeping enough? Are you actually doing things to try and to reduce your stress? And sometimes people forget that stress isn't just like, oh my God, I've had a really busy day. It can be over exercising, as an example, there's quite a lot of things obviously that can kind of go into that, probably too much to talk about right now. But
and for anyone who is looking for a food diary example, we actually have one on our Field Doctor site on the Resource Hub. There is one there that you can just download for free, just to kind of see, and it has all those things on it, relaxation, sleep, so you can just start to print off a couple for a couple of days.
Yeah, and actually we talked earlier about getting your gut healthy via diversity, and obviously that's something that field doctor try to do in terms of getting more plant foods into your diet, and more variety as well. And that kind of brings me on to the last thing I'd like to discuss, which is the low FODMAP diet and field doctor. Now, before we kind of get into this, I actually really want to give some background about my experience. Is that, so as I mentioned earlier, I went to do my degree in nutrition, and at the time I was suffering very bad IBS. I lost a lot of weight very, very quickly. I went through all the doctor kind of tests to make sure that I didn't have IBD or celiacs, and I was fortunate enough that the low FODMAP diet had kind of started being introduced into the UK, and essentially, and obviously we'll talk about what that means, but like I say, I really benefited from it, but at the time I found it really difficult because there just wasn't any low FODMAP foods available. And actually that's what I did my research in. I ended up doing my master's dissertation in the low FODMAP diet, how it can be beneficial, but how it's quite difficult to then actually, unless you're cooking for yourself all the time, it's quite difficult to actually to implement. But that kind of brings me on to what is the low FODMAP diet? Why can it help? What does it actually mean? And yeah, I guess some main things to kind of consider.
Yeah, so it's a bit of a mouthful. FODMAP stands for fermentable oligo monosaccharides and polyols. You can tell it was developed by a science team. It actually came out of Monash University, the research team there. They were the first ones to give it this name. And these FODMAPs, as we will refer to them, are fermentable carbohydrates that trigger trouble in your system. They either, as they're going through your gut, draw more fluid into your small intestine. So there's a movement of water, and hence why you may sometimes feel this distension and pain, but also often they're not absorbed, so they end up in your colon, your large intestine, where there's all this bacterial fermentation that happens, hence the bloating and the wind. And what the researchers has discovered is if you could remove some of these FODMAPs from your diet, people just had less of these IBS symptoms. And it's quite a complicated diet because it's not as easy as just removing wheat or even milk. FODMAPs exist in a lot of different common foods that we eat. Yes, lactose in milk, as well as fructan, which exists in wheat. So it is a wheat and low lactose diet. But also you find these oligosaccharides in onions and garlic, which obviously is used in already.
That's actually what I can't.
Is that your trigger?
About the reintroduction, but that's one of my triggers. I can't eat garlic and onion. Tried reducing it many a times, and it's
the most common problem. Actually, everybody wants to blame wheat, but actually, onion and garlic and alliums can be a real issue.
Pizza, so I'm fine. I'm happy. I can eat my lactose. I can eat my wheat, but I just can't eat garlic and onion. So no curries for me, but I can have pizza. So
and the vegetables. I mean, it's just, it's, for example, in cauliflower and asparagus, and you'll find it in beans and pulses, and polyols are found in a range of different mushrooms. And fructose is one of the FODMAPs, and of course it's there are high fructose foods such as mangoes or even sugar snap peas, so you have to be sort of quite careful in and certain quantities. So Monash have done all the analysis on this, and this is why we wanted to create these low FODMAP meals, because it can be quite complex to know what to remove. It is it's a 3-part diet. The first stage is the elimination, where you're removing FODMAPs from your diet for a maximum of 8 weeks. Usually it's about 4 to 6 weeks. And then the second part is you slowly start to reintroduce them. There are specific challenges, 8 challenges across 8 weeks, where you're trying to find out which your triggers are. And that's the most important part of this diet is the elimination may make you feel better, but if you don't know what it is that are your triggers, you are living a life with removing hundreds and hundreds of things from your diet, and it's really empowering to know what your triggers are, as you've just said, with the onion and garlic. Also, it's important to bring back FODMAPs because it's not a diet for life, because we know that FODMAPs are often, a lot of them, prebiotics. And we touched on prebiotics earlier. Inulin, found in asparagus, is really important and feeds our good bacteria. And there has been research studies to show that lengthy FODMAP elimination does affect certain bacterial groups, such as your bifidobacteria, in a bad way. So we want to make sure that you're bringing this back in so that we're having a good, healthy, diverse microbiome. Also, it's not, if you're removing too many things from your diet, there's a risk of it, nutrient depletion and not having a nutritionally balanced diet. And then once you've brought them back in and found out what your triggers are, you have this sort of personalized management of it. And in your case, you now know that onions and garlic are your issue, and so that you'll also know how much. For some people, one piece of toast is okay, but two pieces of toast is their trigger. So you have to understand what the triggers are and how much of them that you can have. We've mentioned it's not a diet for life, and the other thing I would urge is it's a complicated diet. So definitely, trying the first line stuff. Most people do really well on first line dietary changes that we mentioned a bit earlier on.
Alcohol.
Regular meals, a much more healthier, balanced diet. But for those where that doesn't work, this can be a fantastic tool. And 3 out of 4 people that follow this diet do see an improvement in their symptoms. But best to do it with a FODMAP trained dietitian so that they can guide you and make sure that you're doing right and help you. Or I'd also recommend downloading the Monash app. That you've got the logo down there, which is great. Download that Monash app. It's got all the information on it as to which foods, and then also to remove and the right challenge. And all our meals have been certified low FODMAP, or at least our low FODMAP meals have all been certified by Monash University to be suitable for the elimination diet.
And I just kind of like to add, I suppose, to that is that your personalization is really important, because with FODMAP foods, it's a kind of a cumulative effect. So I'm just going to give some examples. So mango is high FODMAP, onion is high FODMAP, wheat is high FODMAP. If you had all 3 of those in one meal, you might get symptoms, but by themselves in small amounts you might not. So that's why it does become a little bit complicated, and it's good to see someone that understands and has training in this area. Now, for me, for example, I can't eat onion and garlic, and I just pick my battles, because I'm like, do you know what? Sometimes I'm going to go out for dinner and I just have to pick the thing that I know has got the least amount in. And then there are certain foods that I know if I have one mouthful of, I'll be absolutely fine. If I have a whole dish, and that's why, like, really, this is why it is super personal to each person, how you digest foods, that sort of thing. I find it really useful. I'm really happy that there's a meal option now where you can have something to help. I think that's really important. So I think kind of really brings us to the end of the presentation, or the end of the webinar. There is a Q&A option. I don't know if anybody wanted to ask anything, but so I'll leave it open for a couple more minutes. But yeah, so you can get Field Doctor on
by the website fieldoctor.co.uk. We only sell via our website, and they're healthy frozen ready meals, so they arrive frozen and go straight into your freezer, because that was the joy of it. you don't know, sometimes you just don't feel like cooking, or you've been invited out to dinner and you don't want to trouble them with having to cook you. So you can whip one out and bring it with you. The idea was just to try to have a convenient solution and to help people start to enjoy meals that they traditionally haven't been eating, because they were worried about the symptoms. You mentioned curries. We wanted to help people have curries again and fall in love with food again and have pasta dishes and, but healthy versions of. We only cook with extra virgin olive oil, and we try to cram as many low FODMAP vegetables and grains into our meals as possible. You see the diversity score. All of our meals have got a diversity score to help you on your goal of reaching 30 different plant types a week.
And actually, I just remembered, so we've kind of put here nutritional risk, and actually one of the things that I find is, this isn't necessarily just for IBS, but when people cut out foods with no, obviously this is quite a complicated diet, but even if you do just cut out something like gluten, for example, you can then start missing out on nutrients that you really need in the diet. And sometimes people have this, I think it's starting to move away from this, but there's this concept that, a gluten-free diet is healthier, but it's not. It can be for some people, but for most people, actually it's half the time you swap it for a gluten-free alternative, and that's got less fiber, less nutrients in it. It hasn't been fortified. So yeah, I think it's that's why it's helpful to speak to people. We obviously assess nutritional status, and we have people on hand to that we have like a microbiome specialist, for example, but it is helpful to try and dissect some of this with someone to help you on your personal journey. But yeah, so I think that kind of brings us to the end. We are only 5 minutes over our scheduled time. We've got one question. Interesting, this, since going vegan, my stomach has unsettled and rumbles a lot. What would you recommend for this, and potential reasoning? Now, I can kind of give an idea around reasoning. It's likely that you've massively increased your fiber intake. You've massively changed your general diet. And a lot, you do see this a lot with people going vegan, is the change in diet, the increase in fiber, and a lot of the time it does settle once your body's got used to it. But I don't know if you've got any other tips.
No, exactly that. I think the risk, sometimes what happens is you're going from a non-vegan diet to a vegan diet full of fiber, and it's just a big adjustment, and everything, your bacteria are having a great time. Everything sort of needs to settle down a bit, and it will adjust. Generally what we try to advise is, just to slowly increase one's fiber step by step, but obviously that's quite a big dietary change. And then that would lead to, you're going to be introducing a lot more pulses into your diet, because they're a great source of protein, and those are always linked with a little bit more gas and rumbling. But, for all the good reasons, they are great, as we know, in terms of helping produce short chain fatty acids, such as butyrate.
And actually, one that's kind of brought one little thing actually is that sometimes people worry too much about a little bit of bloating, a little bit of rumbling. It's quite common. It's not it's a lot of the time it's just your bacteria doing its job. It's when it becomes unmanageable and painful, and it's very common, that's when that's when you might have IBS, or you might want to assess your diet. And actually, I know things like lentils and chickpeas, the first time if I haven't had it for a while, I will get distension and a bit of pain in my stomach. But if I introduce it by literally having a spoonful a day for a couple of days, having a break, and then over time, I'm actually completely fine with eating it. But so it it's not always the end of the world if you have a bit of gas. It's quite normal.
No, everybody farts. It is an absolute fact. The other thing I'd say is everybody's tummy is actually making noise, and you can speak to any gastroenterologist and they will always listen for intestinal sounds, because that is another link with healthy gut. A silent gut is not a good gut.
Interesting. I didn't know that. Right, any more questions? If not, you can reach me. I'm on Hand Nutrition. We've also got people on Instagram at omnos.me. And Sasha, I don't know where, if it's best to contact yourself or...
Yeah, or contact us on social media. We're at Field Doctor UK, and send us a DM.
Fab. Lovely. Well, thank you so much. I'm going to finish this now, and this has been super interesting.
Likewise. Thanks, Hannah. Thanks so much. I really enjoyed this, and thanks to everyone who joined us.
Yes.